to discuss vitamin A. Vitamin A is a group of fat-soluble retinoids including retinol, retinal, and retinyl esters. It is an essential vitamin needed for growth and development, cell recognition, vision, immune function, and reproduction. It is a powerful antioxidant and acts as a hormone in the body, affecting the expression of genes and thereby influencing phenotype. Vitamin A is found in different forms. Preform vitamin A, retinol and its ester form retinyl ester, occurs in meat, fats, and dairy produce. Provitamin A is stored in fruits, vegetables, and other plant-based products. Retinol is the predominant active form of vitamin A found in the blood. Beta-carotene is a precursor of vitamin A and is found in plants. The provitamin, in itself an antioxidant, is converted into vitamin A as needed by the body, so there is no risk of overdose or toxicity. Coming to the benefits of vitamin A. As vitamin A affects a wide range of body functions, a deficiency can lead to a variety of problems. These include night blindness, a higher risk of infections, especially in the throat, chest, and abdomen, follicular hyperkeratosis leading to dry, bumpy skin, fertility issues, delayed growth in children. An adequate amount of vitamin A may have the following benefits. 1. Lowering cancer risk. Adequate intake of carotenoids from fruits and vegetables are associated with a lower risk of lung cancer. Some forms of vitamin A may help protect against prostate cancer. Beta-carotene may also help protect against colon cancer. Next, it helps maintain healthy skin and hair. Vitamin A is important in the growth of all bodily tissues, including skin and hair. It contributes to the production of sebum, the oil that helps maintain the levels of moisture in the skin and hair. Coming to the sources of vitamin A. Ready-made retinol, the active form of vitamin A, only comes from animal sources. The richest sources of retinol are organ meats such as liver, fatty fish such as herring, salmon, and fish oils, butter, milk, and cheese, eggs, plant-based foods containing carotenoids, antioxidant forms of vitamin A. These are converted to retinol in the body. Carotenoid is an orange pigment that contributes to the color of certain fruits and vegetables. Vegetable sources that are rich in carotenoids are pumpkin, carrots, squash, and other orange-colored vegetables like sweet potato. Orange-colored fruits such as papayas and mangoes are also good sources of vitamin A. Plant foods rich in beta-carotene include broccoli, spinach, turnips, and other dark leafy green vegetables as well as peppers. Now coming to the RDA for vitamin A. Up to 6 months, the adequate intake is 400 micrograms per day, and from 7 to 12 months, it is 500 microgram per day. These figures represent the mean intake of vitamin A in healthy breastfed infants. From 14 years, the requirement for males is 900 microgram per day and for females 700 microgram per day. For women aged 19 to 50 years, the requirement is 770 microgram per day during pregnancy and 1300 microgram per day while breastfeeding. Coming to vitamin A deficiency. Vitamin A deficiency is common in many developing countries, often because residents have limited access to foods containing preformed vitamin A from animal-based food products, and they do not commonly consume available foods containing beta-carotene due to poverty. According to the World Health Organization, 190 million preschool-age children and 19.1 million pregnant women around the world have a serum retinol concentration below 0.7 micromoles per liter. In these countries, low vitamin A intake is most strongly associated with health consequences during periods of high nutritional demand, such as during infancy, childhood, pregnancy, and lactation. In developing countries, vitamin A deficiency typically begins during infancy when infants do not receive adequate supplies of colostrum or breast milk. Chronic diarrhea also leads to excessive loss of vitamin A in young children, and vitamin A deficiency increases the risk of diarrhea. The most common symptom of vitamin A deficiency in young children and pregnant women is xerophthalmia. One of the early signs of xerophthalmia is night blindness or the inability to see in low light or darkness. Vitamin A deficiency is one of the causes of preventable blindness in children. People with vitamin A deficiency tend to have low iron status, which can lead to anemia. Vitamin A deficiency also increases the severity and mortality risk of infection even before the onset of xerophthalmia. So who is at risk of vitamin A deficiency? The highest risk of vitamin A deficiency is among preterm infants, pregnant and lactating women, people with cystic fibrosis, those consuming the weight loss drug orlistat, which is also known as ALI, reduce the body's ability to absorb fat-soluble vitamins such as vitamin A, increasing the risk of its deficiency. Vitamin A supplements are available for those who have difficulty absorbing the nutrient, but it is best to meet needs through food, not in isolation. The use of supplements can mask possible deficiencies of other nutrients, potentially leading to acute and long-term health issues. Lastly, coming to the risk of excessive dose of vitamin A or vitamin A toxicity. Preformed vitamin A can be toxic when consumed in excessive amounts, either through diet or supplementation. The tolerable upper intake level for vitamin A varies by age. The upper limit is the amount above which vitamin A intake may be toxic. Overconsumption of vitamin A can be toxic and it can lead to skin changes such as yellowing, cracking, itching, and heightened sensitivity to sunlight, vision changes, and in younger children, double vision and brittle nails, hair changes like hair loss and oily hair, weak bones, bone pain or swelling, vomiting, dizziness, headache and nausea, difficulty in gaining weight and decreased appetite, gum diseases, irritability, fatigue, drowsiness and changes in alertness and mood swings, a bulging fontanelle or the soft spot in the skull. Liver diseases can occur in cases of extremely excessive intake. Pregnant women should not consume more than the recommended levels of vitamin A because retinol has been linked with fetal deformities. Retinol is also available as an anti-aging skin cream. This too should not be used by pregnant women. Those who take isoretinoin for acne treatment should also take care not to consume too much vitamin A and to avoid vitamin A supplements because this drug is a vitamin A derivative. A healthy, balanced diet should provide enough vitamin A without needing of supplements. Thank you very much.